Euthanasia and physicians-assisted suicide are very similar. However, both are defined differently in both moral and legal levels within our society. Euthanasia, as defined by the Webster's Dictionary, is the act or practice of killing or permitting the death of a hopelessly sick or injured individual, such as a person or domestic animal, in a relatively painless way for reasons of mercy. Whilst the definition as told by MedicineNet is defined as being the voluntary termination of one's own life by administration of a lethal substance with the direct or indirect assistance of a physician. At first glance, each seem very similar, but from legal and moral standpoint, they are very different. In this speech, we will discuss the differences between the two whilst taking a deeper look at the morals and ethics of each, the impacts on medical professionals, and the overall humanism of the two acts. As human beings, we hold a distinct fear or a curiosity over after we cease to be. This fear stems from the idea of the unknown, the fear of the unknown, the inevitable cliff that is quickly approaching. We are often left to wonder what may bring to a person to wish themselves more quickly to a swift end. As per our own nature, we tend to see euthanasia and physicians-assisted suicide as unmoral and unjust. But if you look at it from the perspective of the patient, that view may change. To allow a terminally ill individual to end their life is the only humane, rational, and compassionate choice. In an article written by Dr. Kalish, he argues that he believes physicians-assisted suicide to be immoral, and why he believes it should be legalized totally. He goes on to speak of how it is wrong to allow a terminally ill person to continue their suffering rather than allow their choice of escape. They say that our bodies are our own, and we should be allowed to do what we want with them. In the UK, physicians-assisted suicide and euthanasia is currently illegal, however seen by very few as immoral and wrong. Meanwhile, a clear majority believes it should be legalized. According to BBC, 80% now see euthanasia as a right and wish to give terminally ill people the right to a clean and calm death. As the debate continues, we see numerous amounts of people joining the fold and helping to further this debate and help it reach the attention of both the public and hopefully the eyes of lawmakers. However, we also see some coming forward and stating their wishes for the legalization of such practices. There is another type of suffering which in my viewpoint is even worse. It is called anticipatory suffering, and it includes the depression and anxiety that accompanies fear of death and the fear of what is believed to be the inevitable suffering that comes with an end of a life. Annette believes it is more immoral to deny the right to a dignified death. Today, assisted suicide is legal in 4 U.S. states and 3 countries. While this is a great start, it is not enough. Doctors everywhere should be free to offer euthanasia for terminal illness, says Hayes. As the debate continues on and we see more and more people joining, it's an old issue, one that has been discussed in different ways for hundreds of years. And I think, as a people, it is time to end the debate and to bring to fruition the ability to end one's own suffering of terminal illness. One may ask, but what if it is abused? I simply answer with that. Laws and regulations can and would be put in place to ensure euthanasia isn't abused. We've seen occurrences of abuse as we've seen of the need. Suffering and pain are things that I believe we as a people have the right to opt out of. When the fact of the matter is there is no getting better, terminally ill patients must be given the right to free themselves and move on from the constant suffering that they may be feeling. So parting with you, I urge you to join the debate and help legalize euthanasia for those who need it most.
Yay! Woo!
We clap.
Yeah,
we clap.
And then